Tricia Ang, psychotherapist and counsellor. So Tricia is a registered art psychotherapist and counsellor who is passionate about empowering people to experience a deep sense of well-being so they may live a fulfilling life. She has over 10 years clinical experience working in paediatric, educational, mental health and trauma recovery settings, specialising in assisting people to heal from trauma, relational issues, eating disorders, body image and self-esteem issues, anxiety and depression. All of these are nowadays issues. And of course, the focus of today's chat, overwhelm. Welcome to the Hub, Tricia. Lovely to have you.
Thank you so much, Lindy. It's my pleasure to be here.
Lovely. All righty. So overwhelm is a state that many women find themselves in after years of sustained stress and taking on the mental load. It seems our lives have become one of overwhelm, which often leads to self-medication as a coping mechanism. In simple terms, what can start off as a glass of wine to wind down at the end of the day leads to a bottle of wine, even more, just raises the anxiety and overwhelm. It's self-perpetuating. So I know for me, it was a glass or two while I was cooking dinner, but I found cooking quite a therapeutic exercise at the end of the day. But, you know, I did start to get to the point where there was way more than just a couple of glasses with dinner. The glasses just increased with the demands of life. So, you know, I feel like finally at this age, I'm starting to get that under control, but I'd like to be able to share a little bit more to help women in this space to be able to manage that level of overwhelm. So tell me about art therapy.
So art therapy is an experiential therapy that involves creative art making. And it's like going to a counselor, but we also use art making in the process. And art therapy is not an art class. So we distinguish art therapy from an art class in that we are not attending art therapy to learn a skill or, you know, how to create a fantastic piece of art. So the focus of art therapy really is on the process of making the art, as well as meaning making at the end of the art making process. And a lot of times people think that they need to have some kind of skill to be able to engage in art therapy, but that is not true. So it is available for everyone because we all have the innate capacity to create. So art therapy is really a form of counseling where we use art making as an additional tool in the process of psychotherapy.
So it isn't just an art class to be creative. So it's, I guess it's more like a communications tool, is it?
Yes. So sometimes we find it hard to express certain experiences, you know, like especially with children, it can be very difficult to articulate certain difficult experiences in their life. And also sometimes we don't have the words, you know. For me, sometimes I struggle to find the right words to experience, to describe my experience. And sometimes a picture does convey 1,000 words, you know. So sometimes through images, we can actually express ourselves in a way that we can't through words. Yeah. And with art therapy, that is the aim, actually, to help us communicate what we're experiencing within ourselves.
Absolutely, because it is very difficult when you're when you've been exposed to trauma. It is very difficult to often verbalize that. So so what are the different modalities?
So when we talk about art therapy, we are talking about art making in the visual arts space. So we can use different types of materials, sometimes including natural objects or found objects that are a bit unconventional art materials. And I often encourage people to play with the art materials, and with the materials we can, you know, engage in different arts or visual arts making. For example, we can draw, we can paint, we can make sculptures, we can have a collage, or we can do textile art. So there are very a range of ways where we can express through visual arts. And art therapy is a form of creative arts therapy. So under the umbrella of creative arts therapy, we also have music therapy, we have dance movement therapy, and as well as drama therapy. So these are more performing arts based, whereas art therapy is more visual arts based.
Of course.
Yeah.
And so for women who are living in overwhelm, how does that work for them? What would you do for somebody if somebody came to you, that 50 age group, and said, I'm just not coping? How would you implement a treatment program or a counseling program?
So, overwhelm is when the level of stress that we're experiencing exceeds the capacity we have to cope with the stress. That's when we experience overwhelm. And I like to use this analogy that my embodiment teacher, Michaela Bohm, uses, where she describes thinking of all of us having a vessel or a cup inside ourselves that's there to collect the stress responses that we experience. And each stress stimuli or stressor is like a drip into the cup. Yeah. So like it can be small things like being stuck in traffic, or having a deadline to meet, or running late, or even worry or negative self-talk. Yeah. It can be like daily stresses that can seem very small, that adds the drips into the cup. And of course, when we have a lot of all these stresses dripping into the cup, over time it can be overwhelming. So the cup overflows. Yeah. So there are a few ways where we could manage the overwhelm. So one of the ways, obviously, is to empty the cup regularly. When we empty the cup regularly, we will be able to have more space to manage with the stress. And in terms of art therapy, we can obviously use art making as a way to de-stress, because art making itself is a very therapeutic process. Mm-hmm. And we can also use it as a form of expression and release of our stress. Sometimes we don't have a space to actually pause and reflect and express what's actually going on within us. And it's often a way where we could express and release the stress. Yeah. So the second way is really to kind of reduce the number of drips into the cup, right? So if we can reduce the number of...
Not always easy.
Yes, not always easy, because a lot of times, especially the environmental stresses, can be very overwhelming, or it's not within our control, because like for example the pandemic, like we're all subject to that to the external stresses, but we also have internal stresses like anxiety, worry, uncertainty that comes up. And I feel like for art therapy, how it can help to reduce the stresses is through mindfulness, because art therapy is a very sensory experience. We have the art materials where we can feel and touch the materials a lot of times, and we also can see what we are creating, and sometimes depending on what we are doing, we can hear the purpose of the art making. If we are doing woodwork, or something that makes some sounds, or even using charcoal on paper, we can hear the sound, and sometimes we can smell, like the smell of the paint or other materials.
All of those sensory things, isn't it? It isn't just about putting pen to paper or anything, isn't it? It's all of that, isn't it?
Yeah. So because in art therapy, I forgot to say earlier, is that what differentiates art therapy from casual art making, because we can all make art at home, or we can attend art class. What differentiates art therapy from other art activities is that there's a art therapist who's there to have a therapeutic relationship with the client, and that's where they can hold the space and have the container for the client to experience that, because it's not often easy to find that space for ourselves, because there can be a lot of distractions that come on. So what can be helpful in art therapy space is to really engage in our senses and connect to our senses and connect with ourselves, because when we are constantly on the treadmill, we often have to sometimes, because we have so many things to do, we have to disconnect from ourselves, the signals that our body gives us to be able to cope with, the 100 things that we need to do, right? So we have to do that to survive and to function and to meet life's demands. Yeah. And sometimes we can also, like you said, have a couple of glasses of wine, and that sometimes numb us to all these messages, so that we can push forward and take on more things. So I feel like the benefit of art therapy really is, in that contained space with a trained art therapist, we could engage with our senses and be mindful in our experience of art making, and also have a chance to connect with ourselves. And sometimes we also do art therapy in a group, so we also have a chance to connect with others. So art therapy can also happen in a group, so we can connect with others and have this chance to really connect with what's going on within us. And as we become more aware with what's going on, we can then take the action. So we may realize that actually we are taking on too much. We need to put some boundaries and say no to certain things, or we may realize that actually I need some time to rest, to do some self-care. So I feel that that's another way where we could, prevent the drips from coming in. Yeah.
And it's a safe place, right? So people obviously, as you say, if you're with your counsellor, it's a safe place to be able to express yourself, but also even in the group sessions as well. So it's, and being able to interpret, that art, I guess.
Yeah. And actually, that's also the other way where there is, because there's another way, which is to increase the size of the cup. If we can increase the size of the cup, we can take on more of those stresses. And
so is that wise? So is that the idea, that we build more resilience?
Yes. So if we can work in three ways, if we can, so to me, the way to increase the size of the cup, or our capacity to hold all these multiple stresses, really is to work through the woundings or the traumas that we have experienced in our life, because all these past experiences often activate our nervous system in the background. We are often, feeling like we need to fight or flight or freeze to cope with, our the patterns that we have developed to protect ourselves as we have experienced all these traumas. So as we heal our woundings and trauma, we will have more capacity, because we wouldn't have invest all those energy in trying to protect ourselves. We'll be more available to cope with the life demands. So I think that is where the art therapy and the processing of traumatic memories or inner conflict, or making sense of what's going on, can be really very helpful. So and of course, having the safe space with a skilled therapist allows for that to happen.
And so it is, when we talk about overwhelm and getting to overwhelm, is it often the people who have had some kind of trauma, and obviously many people have had trauma, there's a great many, is it often that underlying psychological situation that will often then cause this overwhelm?
I would say certainly that puts people in a predisposition to experience overwhelm. So if you think of someone who has experienced a lot of trauma in their early life, and for some people intergenerational trauma as well. So not just themselves, but their parents or grandparents over different generations that's actually passed on to an individual. That already, their nervous system is already on alert, or it's a lot of energy is spent on protecting the person,
Yeah.
and that there isn't a lot of resources available to manage what's going on. And of course, if you add environmental stresses, so some people have a lot of environmental stresses, so poverty, homelessness, sickness. So if you add all these significant stresses, then that adds another layer. And of course, if we sometimes don't have the capacity or resources, if we are a single parent, we have to support our family. Exactly. We have to keep going with that. We don't have the opportunity to de-stress or release the stress. So that compounds the effect. So I think people with trauma certainly has the predisposition, but of course, like I said, the three areas where the amount of stress we are experiencing from either the environment or within ourselves, the capacity as well as capacity to hold, as well as the capacity to release the stress, all affect how much people experience overwhelm.
Yeah. Well, that actually makes a whole lot of sense to me, that's for sure. Now, I understand that this therapy is broadly used for children and people with brain injuries. But I think we talked about this actually. How does it assist women living in overwhelm? And we have talked about that. So then what is the status of, that wasn't very good of me doing that. Anyway, what is the status of art therapy in the psychology profession? So is it accepted as a normal practice of therapy?
I would say my experience or my sense is that art therapy seems to be not taken seriously in the psychology profession or in the field, and we are often dismissed. And one of the reasons or key reasons is that we don't have an extensive body of evidence base to prove its efficacy, and it's not because art therapy is not effective, therefore we don't have the evidence base. It's because of the like randomized control trials are the gold standard of finding out the effectiveness of therapeutic interventions conventionally, and art therapy does not lend itself well to this method, and this is a very resource intensive method, and we often don't have the resources to fund this research, and also they require a certain sample size, and that can be challenging for art therapists to find enough people because there's lack of resources. And the design itself is also difficult because art therapy, it's very hard to standardize an approach, and it's more abstract. It's more abstract than certain some other psychological modalities. So I feel like we are still kind of catching up, but I feel like there is certainly more emerging studies coming up to support the efficacy of art therapy in different areas. And earlier you mentioned children and brain injury, but actually right now, actually has been for a long time that we actually use art therapy with a wide range of populations. So children and people with brain injuries, but also people with dementia, prison inmates, war veterans, people with various mental health disorders, people with trauma or addictions, people in palliative care, also people who are neurodiverse, or people who have learning or developmental disabilities, and even for people who do not seem to have any significant issues and are relatively functional but are looking for personal development or personal growth, people who want to be more self-aware or have greater self-understanding, or people who would like to develop more mindfulness or self-compassion, want to connect more deeply with ourselves. So there's really a wide range of applications in regards to how art therapy can be used, but I think we are still catching up in terms of the evidence base. And I think it's quite encouraging that in the recent Royal Commission into Victoria's mental health system, art therapists are now recognized as mental health professionals.
Brilliant.
So I think that is really a space that's very challenging for us, because in Australia we are still not eligible to provide Medicare rebates. So that speaks to how well recognized we are, and we are catching up. I think we are slowly making progress, and hopefully people will be more aware of art therapy and its benefits. And this is one of the reasons why I want to do this interview, so that people can know more about art therapy and its benefits.
And that's exactly what we're trying to share too, is what are the other options. I totally understand where you're coming from. The funding isn't there. It's not as simple as, for the medical profession to kind of pinpoint things, and it does make it difficult. But there are so many therapies out there that are supportive of people's conditions, and vitally important to share it. So I read a number of studies, in fact, seem to focus on art therapy for people who have been in motor vehicle accidents and other physical trauma, but not so much abuse, domestic violence, that sort of thing, or child abuse. Is that again another casualty of the lack of sort of medical government support, do you think?
I would say so, because
kind of answered it. So I think that's
yeah. And there has been research studies done, but it's few and far between, I would say. Like we certainly will welcome more studies, but it's all, a lot of times it's funding and resource dependent. So
exactly. But at least it's available, and I think that's the important thing. And just as we get to, you touched on dementia just before. So what about art therapy for healthy aging? We are told to continue to keep our mind active. Can art also support good brain health and potentially reduce the risk of dementia?
So I'm not.
I know that's a big call, but
it's so I'm not an expert in neuroscience or dementia, but
in your experience, do you think?
So in my understanding, or I'm aware that if we were to engage in novel or unfamiliar experiences, we create new neural pathways, and that helps to support brain health, and art therapy can certainly support that, because each time we engage in art making or any creative activity for that matter, if something that it's creative and it's not repetitive, it is always a new experience, and we are kind of trying to find a different way of doing things. And I think art therapy is a wonderful way to do that in a very enjoyable way as well. And so that can be art making, not necessarily just art therapy. But I also believe that as we age and we go through different life transitions to a different life stage, there could be lots of challenges that we face, particularly issues around grief and loss. Like I imagine people, I'm moving towards that stage, so I'm not there yet, but I imagine people, would experience grief and loss when their kids have become adult and move out of their homes, or when people retire, and there could be a sense of loss, because the sense of identity could be changed, and for women, as we age, we lose our youth, and we have changes in our body, and we experience menopause. So there's a lot of changes that can occur, and not to mention death of loved ones. So there's a lot of transitional challenges that could happen as we grow older. And I feel like that is something that art therapy can certainly support individuals to process, or to have greater understanding, or even connect with who they are as we grow older and evolve. Absolutely.
And I think nobody gets through this life unscathed, right? Everybody is exposed to some sort of trauma in some way. Obviously, some much worse than others, but it doesn't matter. There's always trauma. And I think if there's a practice like art therapy that can help, rather than sitting in a room, perhaps, then just talking about that, which is kind of what I've done in the past, it can make a lot more sense and feel a lot more comfortable with a counsellor there to help walk you through it. I think it's a fascinating vertical for mental health. And I certainly think it's something that women, as we get to a certain age and we start going through menopause and that kind of age and going through, it's not a traumatic time, but I think we start to realize that there are a lot of things that we probably need to deal with, but also start to find ourselves again. So you mentioned that it's also a great therapy for doing that. So Tricia, thank you so much for your time this evening. I really appreciate it.
Thank you so much.
We look forward to learning a lot more about art, psychotherapy and counselling. Thanks for joining us.
Thanks so much, Lindy.